Hey everybody, this is Stephanie Levitt from the Wrap Up Diabetes campaign. So who are we and what do we do? Well, our campaign educates people on the signs and symptoms of diabetes. We also educate people on how they can prevent type 2 diabetes. And we develop a plan for those diagnosed with type 2 diabetes to live well and to reduce their risk for further complications. So here at the Wrap Up Diabetes campaign, we want you to know that 31% of British Columbians are living with diabetes or prediabetes. So what can we do? With almost a third of BC residents living with diabetes, we need to learn the signs and symptoms. Regular testing is crucial to managing the disease and preventing further health problems. So this is type 2 diabetes Shelley's story. Shelley is a 45-year-old mother of four, school teacher, and movie fanatic. She has a lively personality and is always laughing with her family and friends. Shelley really enjoys hiking with her dogs. However, she broke her leg last year and it has been too painful to hike ever since. This has had a negative impact on her life, and she has gained 30 pounds, and she isn't nearly as active as she would like to be. Lately, Shelley's husband has been putting pressure on her to join a gym because he considers her weight gain to be unhealthy and unacceptable. Shelley is furious. She isn't going to let anybody tell her how to live her life. She gains 10 more pounds out of spite. Last week, Shelley noticed that she's been very thirsty and very tired. She can't get a good night's rest because she is up all night urinating. All of a sudden, she loses 12 pounds without exercising or changing her diet. Though she is happy about the weight loss, she doesn't understand what is happening to her body, and she goes to see a doctor. After having an oral glucose tolerance test, Shelley finds out that she has type 2 diabetes. She's scared. She's angry with her husband for putting pressure on her to lose weight, but she's furious with herself for gaining 10 more pounds out of spite. Shelley decides to study type 2 diabetes and take control of her health. Sadly, she has to take insulin shots daily. Because of her leg injury, she chooses swimming as a new method of exercises. Before long, she loves swimming. She also works with a nutritionist to help her put together a healthy meal plan. Though her kids don't like her meal plan, they adjust because they know it's in their mom's best interest. After 6 months, Shelley is back to her original weight and no longer requires insulin shots as long as her blood sugar is within a healthy range, which she can monitor at home with a blood glucose meter. Life is relatively back to normal for Shelley. She feels great, her husband is happy, and her kids are too. So, the signs and symptoms of diabetes are unexplained weight loss, weight gain, always hungry, always thirsty, extreme fatigue, numb or tingling in the hands and feet, frequent urination, dry skin, sores that heal slowly, and frequent infections. Who is most at risk for diabetes? Those with a family history of diabetes, anyone with a BMI of over 25, anybody 45 years or older, those that are physically active less than 3 times per week, and women that have had gestational diabetes during pregnancy. So you think you have some symptoms. Now what? Call your doctor. You need to get your blood sugar tested. A blood sugar test can determine if you have type 1, type 2, prediabetes, or gestational diabetes. There are 3 tests available: the A1C test, fasting blood sugar test, and glucose tolerance test. So you've been diagnosed with diabetes. Now what? It is important to see a diabetes care and education specialist. They can put together a management plan that is specific to your lifestyle needs. Work with your doctor and ask for a referral for diabetes self-management, education, and support services. Really, we want to emphasize the importance of getting tested. If you are concerned that you may have some of the signs and symptoms of diabetes, get tested. If you are over 40 years old, you should be tested every 3 years. Early prevention is crucial to managing the disease and preventing further health issues. And from everybody here at the Wrap Up Diabetes campaign, thank you and live healthy.